Hello everyone, my name is Dr. Mercedes Malone. My colleagues are Dr. Atif Siddique, Dr. Asad Haider, and Dr. Dhaval Upadhyay. Here we present a rare case of first rib osteomyelitis in a 27-year-old male. The 27-year-old male presented to our facility with severe right shoulder pain of 3-day duration after strenuous weightlifting exercises. He had a past medical history significant for intravenous heroin use several years ago. He was hospitalized a month ago for methicillin-resistant Staphylococcus aureus bacteremia and osteomyelitis of the right collarbone, upper rib, and scapula. He completed a 6-week course of treatment with vancomycin. When he presented to our facility, his physical exam was significant for limited passive range of motion in his right upper extremity due to pain. His vital signs were within normal limits, aside from a temperature of 100 degrees Fahrenheit. Laboratory studies were significant for elevated white blood cell count, erythrocyte sedimentation rate, and C-reactive protein. Magnetic resonance imaging of his chest, which can be seen down here on the right, showed right first rib osteomyelitis, infectious costochondritis, and a periosteal abscess. His transesophageal echocardiogram and 5-day blood cultures were both negative. He initially received empiric vancomycin and ceftriaxone. He was recommended further surgical intervention. However, the patient preferred to defer treatment and was subsequently discharged. Rib osteomyelitis is rare, and it represents less than 1% of all cases of heterogeneous osteomyelitis. While intravenous drug use is a risk factor for developing osteomyelitis, so is traumatic bone injury. The patient in the study was a former intravenous heroin user, and usually osteomyelitis in heroin addicts commonly affects the vertebra, pubis, sternoclavicular, and costochondrial joints. The patient did not have any history of orthopedic surgeries or injury. However, he routinely participated in strenuous, heavy weightlifting exercises, and these exercises may have put pressure on his clavicle and rib cage joints, predisposing these areas to infection. What makes this case interesting is that it's his first rib that has osteomyelitis. And given that he doesn't have any orthopedic procedures or trauma, what could have triggered this osteomyelitis is the strenuous weightlifting activities. And further pathological workup should be considered in patients with musculoskeletal injury after strenuous athletic exertion. At the top right, we have our references, and this is our case report. Thank you.